Today we'll be giving an example of how to use and put on our post-operative shoulder slings. You'll be going home with these after your shoulder repair. The first thing you'll want to do, and in this case the patient has had surgery on their right shoulder, while they're supporting their arm, you want to put the sling underneath their arm, making sure the pillow is in between their arm and their body. And also want to make sure they're holding onto the ball, and while doing so, you can pull this sleeve up, and as you can see on the top of the sling here, there will be two buttons to click these straps into. Once those are clicked in, you can pull the straps tight using the Velcro. And then again, you want to make sure that this is extended past their wrist so the wrist is snugly fitting into the sleeve. After that part is done, there's a strap back here that's going to secure the elbow into the sling. You can pull that tight over the side and Velcro it right there. The last strap we have is a strap that goes around the patient's back, which we'll take around over here, and it clips into the front of the sling here. After it's clipped in, you can pull this tight so that it fits securely around the patient's waist and provides them some support. And again, we'll also Velcro on the side of the strap here. This is all the patient needs. They do not need any shoulder strap or sling. But if you do want to add a shoulder component, there is an extra strap in the back here, which you can add to give support around the shoulder. This one has two simple straps. The first one will be strapped on the back part of the sling. And first one will go right here. And while going around their non-operative arm and shoulder, the second part of the Velcro will attach down front here. And again, this part can be pulled tight to the patient's preference. And this is the proper way to wear this shoulder sling. These are going to be a few examples of how not to wear the sling. In this first example, the patient's wrist is extended past the sleeve. This will cause the patient's wrist to drop down and droop and give the patient some wrist pain and hand pain. Here's example 2 of how not to wear this sling. In this example, you can see the patient's arm is pointing down and is very low around their waist. In this example, you want to make sure the patient's arm is perpendicular to the floor and sitting up around their midsection. In this example of how not to wear the sling, the patient's arm is sitting on top of the pillow instead of on the outside of the pillow. So as in the example we showed you before, the patient's arm should not be sitting on top of the pillow, but rather the pillow should be in between the patient's body and arm.